Welcome back to Medicine Deconstructed. I'm your host, Dr. Jay Rutland. You guys all know I love to teach, but I also love to listen, sometimes. I asked two of my most recent PA students what their top 3 fears were going out into the real world and practicing. It was very interesting, but let's hear from them. Our first fear is the worry about missing a life-threatening diagnosis. It's a common concern among healthcare providers. But let's hear some experiences.
Just last week, Dr. Rutland and I had a patient with what appeared to be vague respiratory symptoms upon initial presentation. However, after further interviewing, it was discovered she had been experiencing angina. She was short of breath with exertion and began to have pain with exertion as well. After putting everything together, I knew we needed to work her up for ischemia. We also needed to give her a plan if her stable angina became unstable. This plan included visiting the ER if symptoms persisted at rest. She will be worked up by cardiology for ischemia.
This is challenging. Experience brings a lot of value in these situations. So what can be done to mitigate this fear?
Literally ask yourself, is there anything about these symptoms that will kill this person? Make sure your history taking is thorough. And also, don't hesitate to seek a second, more experienced opinion from colleagues.
As an ICU doctor, I have the advantage of understanding why people die and knowing the tests and labs that can be done to give us clues into possibly preventing that mortality. It's probably my primary reason for continuing to practice in the ICU. Our next fear revolves around polypharmacy. This is managing multiple medications. So we're going to get into this with one of my favorite students, ZQ.
Managing medications for patients with complex regimens can be overwhelming. We often see patients with more than 5 medications, sometimes even more than 10. As we know, medications can cause side effects, and so managing this appropriately is a fear many of us share.
One of my biggest pet peeves in medicine is side effect of medications. I think it's stupid. Medications have mechanisms of action. These are not effects on the side. They are actually the effect of the medicine. So,
wait a minute, Dr. Rutland. We need to understand how medications work and ask ourselves the mechanism. Once we understand that, we can look at this list and eliminate unnecessary medications. We also can ask if there's a way to consolidate. Nowadays, one pill may have 2 or more medications within it, eliminating multiple pills from a patient's cabinet.
Know how the medicines work and consolidate where you can. Moving on to the fear of having difficult conversations with patients. This is tough. I do this daily and I still struggle. But let's hear from someone who doesn't do it as much. ZQ?
Having those conversations about bad news or sensitive topics is never easy. It's a fear I think we all grapple with. Something that scares me the most is when, let's say, a patient is diagnosed with cancer and they break out sobbing right in front of you and you just don't know how to deal with their emotions.
Definitely. So what strategies can be employed to navigate these difficult conversations?
Empathy and active learning are fundamental. Communication skills, training, seeking guidance from mentors, and building rapport with patients can make these conversations more manageable.
Experience is important, but more than that, your effort in understanding a particular organ or disease state is more important. I encourage practitioners to educate at the bedside and explain why someone is dying. Explain why medicine or surgery can't help a natural process. You have to establish your exploration of doing everything while having the humility to articulate when there is nothing more you can do. This takes loads of study and understanding of the vital organs being affected. Read a lot, listen a lot, answer the questions. Thank you both for sharing your experiences and insights. Addressing and overcoming these fears is crucial for providing the best patient care. And to our viewers, thanks for joining Medicine Deconstructed. If you face similar fears or have your own experiences to share, feel free to comment below. Don't forget to subscribe, like, and share for more content on navigating challenges in healthcare. Until next time, take care.